and welcome to the first
Oh,
edition of Branching Out with Brandi, uh, an MHA vodcast. And my first guest, who seems to be a very uniquely qualified to be my first guest, is our outreach coordinator in the Kokomo Howard County office, Joe Breedlove. Joe, welcome to the program.
thanks for having me.
Yeah, I'm excited. One of the things we've been trying really hard to do is to get the office in Kokomo up and running full speed since our merger. But for our audience's sake, we got to take them down that trail. We got to give them the story. Um, and one of the main things that you do and have done for many years and kept MHA. Our gift lift program going, even through COVID and every other difficult thing that we've encountered. And so, if it's okay with you, I'd like to really just get your take on what Christmas gift lift is and how you've experienced it in your different iterations as a recipient and then a volunteer. Just walk us through that, if you don't mind.
Sure. So I've been my whole life been in and out of a lot of psychiatric units and state hospitals and stuff. But one particularly bad year, I was in a hospital about 10 months, an 11 and a half month period, and I spent a week in a group home right before Christmas before I went to a state hospital, and I received a bag, and I didn't know what it was. It was a big bag just full of hygiene and socks and chocolate and notebooks and crosswords and all sorts of stuff. And I was really struggling. But I was still able to appreciate it. And I still was touched by it. I just couldn't imagine someone, I'd been in a hospital for a long time. I didn't know anybody. And I was just in this group home for a week, and they were able to get me a bag. And I remember being touched, but then again, I was on my way to the state hospital, so I couldn't really do anything about it.
Mm-hmm.
And when I got out, I was still struggling, still trying to find my footing, still trying to get stable. I was going to lots of groups every week, and Christmas came around again, and I got another bag, and I just remember being touched. And by that time, I was starting to kind of, get a little bit of footing and feeling comfortable about doing some things. So I decided to try to find out what this was and reach out. And I found out about Mental Health America. At the time, I think it was still called Mental Health Association of Howard County, I think. And so Gift Lift was over, but they had another program called Social Club. So I started getting involved. It was a weekly thing back then. It was actually 2 times a week back then. And I got involved volunteering on a weekly basis, just serving food and just being around people, and then getting more and more stable as I was doing it. And by the time Christmas came back around, they trusted me enough to get me involved, because they like to keep it kind of small at the time. A small group of people kind of keeping their hands in it so it doesn't get too chaotic, but even though it kind of still was. But so they brought me along, and I got involved that way. And it's been 15, 16 years I've been doing it. I mean, between Social Club and Gift Lift, so being involved with it.
I believe it's the longest running program that MHA has been participating in. Do you happen to know off the top of your head how long it's been?
So I looked it up. I looked up a couple of the letters and stuff, and there was a little bit of a discrepancy. One letter in 2018 said 67 years, and the letter in 2020 said 70 years. So 72, 73 years. I guess. I'm not exactly sure.
70, so over 70 years. MHA has been basically, just to give an overview, providing a Christmas, a token of warmth, friendship, and caring to people who may be struggling with their mental health, or they might have a serious mental illness or a dual diagnosis, right?
Yes.
Yeah, and last year, pretty much single-handedly, I know we helped you logistically speaking with the purchasing and stuff like that, but you pretty much single-handedly handled the gift lift. And how many bags do you think?
So I was looking at that again too. I thought about 525, but I looked at the spreadsheet and it said 470, but then at the very bottom I added 70 at the very last second because I almost forgot the 2 hospital wings, and a group and a nursing home came in and said that we didn't reach out this year, so I made 30 bags. So that's 70. So that puts it at 540. And I'm pretty sure Logansport only counts as 1 line, but they actually get 20 things. So you can almost add 19. So that would be, 559 if you want to count it that way. I mean,
Yeah.
so it's a good number because I think before that, the few years, it was maybe more around 450, 425. So
Yeah, COVID kind of took a toll on agencies such as ours. Plus, I think it's pretty common knowledge that some funding sources were no longer there. But let's talk about funding, because you can't do a program like this without the funding. So one of the things that is really important to do is to recognize this program that's called We Care. And I got to tell you, when I first moved to Kokomo, I just kept hearing We Care, We Care. I didn't even really understand it. And the entire city, and I don't know, what are there, 60,000 people? There's a lot of people in Kokomo. And at least on my block, that's what everyone was doing, was running in to watch this telethon. And I'm like, what is this thing? Way before I came to MHA. I got a really good idea of it when I came to Mental Health America and even began volunteering. So it's really cool. This entire community participates by either donating items to be auctioned or purchasing the auction items. And the Hope doll is the coveted. It's, it looks like a doll that's been left in the streets, maybe run over a couple of times, but the doll's name is Hope, and it elicits the biggest donation. And so basically they have this huge fund, and they parcel out to, I think, 5 or 6 organizations. We happen to be one of them. And we, through that program, are able to provide these Christmas bags to people that otherwise wouldn't get a gift, whether it's for financial reasons or whether it's because they don't have family to support them. So one of our coolest programs. We're super happy, and we're promoting that because we're going into that season, and we want to kind of reopen the conversation around that. So that's our Howard County Christmas gift lift, and Joe is the guy that pretty much keeps that thing rolling. Although we have an entire team behind the scenes, and we got volunteers that still wrap. And because of the generosity of We Care and hopefully other donors that will continue to support the program, we'll be able to do that. And then just wanted to put that information out in case anybody wants more information. Call the main office. And now, Joe, I'd like to talk a little bit. We finally got you some company there in the Kokomo office. So Joe and my story kind of collides. I joined MHA's executive leadership in December of 2016. And Joe was a volunteer there. There was a couple other staff, and I asked Joe to become part of our paid staff. So then, obviously, I moved to Lafayette here to be with the Wabash Valley Region branch of the MHA. And then in January of 2021, we absorbed the Kokomo office, which also served Miami County, Cass County, and Tipton County. So Joe has been sitting in the office waiting for some help. And we wanted to make sure that the community, through this podcast and through talking about the Christmas Gift Lift program, was aware of our other programs. And so you have a new office mate, Ayla Vandergriff, and she is a navigator.
Yeah, she's come in and she's hit the ground running. I mean, she's taking appointments and talking to people and helping people get services. So navigators normally they're just plugged into this huge database that just so many resources that they can connect, most importantly to therapists, and try to get them help. but they try to go through all the barriers and help them break all through all those, and whether it be insurance or transportation, and just get them connected, get them appointments, help them get appointments set, or they kind of want them to help themselves, so they at least provide the information, and then hopefully they'll put the work in. But we try to keep in touch with them to make sure they're kind of still going along that process, and yeah, like I said, she's really hit the ground running. She's diving in. She's finding resources already. She's taking appointments, and she's already done some outreach as well. So
now you mentioned huge databases, because that is, in general, in the past, if someone needed mental health care, they would either have to Google it or tap into a major database or call a 211 or something like that. Why our database is special is because we own it. We have someone full-time working to maintain it. So we're not relying upon virtual dead ends that exist when you call a different line or try to use a different search engine to get help. We know we have faith and credibility in our database because we own it, and that means it's updated in real time, and that's what makes it special. And we are in the barrier removement business, so if you can imagine, and I know Joe and I can both imagine being in a mental health crisis, needing to get help, and then having to walk through all that red tape, that's not going to serve anybody. So that's what our navigators are there for, is to remove those barriers and take on the load of some of that. But what happens if they do have a waiting list, or maybe they're not ready for clinical care? You want to talk a little bit about that program, Joe?
Sure. That's the Let's Talk program. It's our peer program, and it's like you said, it bridges the gap. Because unfortunately, a lot of therapists have long waiting lists. So, but they still need to see people. They still need to talk to people, and the peers kind of offer life experiences, and they do a lot. They help bridge that gap to get you to this therapist, but they also help set goals, offer lots of support. And the most important part is they can offer their own life experiences, which really helps the person they're talking to, that they can kind of connect and realize that there's possibility out there, and there's hope out there, and that they can get through this, and support always helps that. After hours, when they still need that help, there's other options out there as well.
Right. Segue into our crisis line that is 24/7. That is available to Howard County residents, and that is talk, text, chat, that can all be accessed again on our website. And so I've kind of got that scrolling along the bottom there. The main point is that people are never alone. There are other people that can help ease the pain and anxiety of a mental health challenge, everything from support groups to crisis lines to peer support and navigation when someone's ready to get help. We started talking about Howard County Christmas Gift Flip because that's a program that is going on right now, and Howard County residents are going to benefit from Hope and Help, from the MHA office, and from the people who help fund us to make that reality. And Joe, you are living proof that there's always hope, and all you really need is for someone to extend their hand in that darkest hour, and now you get to be the hand, and that's got to feel great.
It does. It's I can't imagine being able to make it through what I went through that last time. I mean, and ever since then, because of this support, and I've built this kind of safety net, but it's a good support, and it started there. It just really started there, and then to be able to build the support, and I've managed to pretty much stay out of the hospital since then. I mean, with a short stint here and there, but nothing to that degree. And that's been a long time, and it's because of support. I mean, that's the biggest thing. But this, for me personally, it was support through MHA and through their programs, the Gift Lift program, social club programs, and you especially just kind of always been there to support me and kind of see some ability and and I really appreciate it. I mean, I've always appreciated it. So
I appreciate you too. What would you say to someone who's out there struggling right now that maybe can stumble across this podcast? What just really, if you just had like a sentence or two that you would want to share to a brother or a sister in pain that's struggling, what would you want to tell them?
you have to reach out. I mean, I know unfortunately there's a stigma, and a lot of people feel like it's a sign of weakness, or they feel like they're a burden to try to reach out and ask for help. That you have to do it. I mean, I just remember that when I finally started talking about some things, and I mean, it was a literal weight that came off my shoulders. I didn't expect that. I just thought, because I'm always a pretty skeptical person, but I really felt a literal weight come off my shoulder, and just being able to, I don't want to say rely on help, but just knowing that it was there, and knowing that I had that safety net, that I wasn't going to just fall through again, and that just, you have to reach out. You just don't worry about the stigma. It's becoming more and more apparent that everybody knows someone or has gone through their own mental health crisis or issues, and it's just so apparent now that it's so much easier to work together and depend on each other to get through that, and just, you have to reach out.
It takes a lot of courage to reach out. So the stigma is complete bull.
Yeah.
You and I both know it. I don't know about you, but I feel a whole lot stronger today than I ever felt before. So there is great strength in reaching out and tackling your problems head on. So, Joe, I want to thank you. I really enjoy all of our time that we get to spend. It's not nearly as much time as I'd like to, but I think your testimony is powerful. I love that you're on the team, that you've continued to buy in to what it is, my vision and what we're trying to do. And your team thinks that you are the best. Joe from Kokomo. Let's honor the work that Joe's doing. If you have a donation, if you'd like to give some money, or if you want to help spread the word about our programs, however you want to help, let's get it out there. MHAWV.org. Like us on Facebook. We're MHA Wabash Valley Region. Join our team.
I appreciate it. Thank you so much for having me.
Thank you, Joe.